Good afternoon. Welcome to another program of Islamic ShuraTV health program. My name is Dr. Zachariah. Welcome. Hope you're having a wonderful summer and a great time with your friends and family. Stay safe. Today we wanted to discuss a little bit about attention deficit hyperactivity disorder, ADHD. We see ADHD talked about in the media and amongst school teachers and parents a lot. And in the last 5 to 6 years, we've seen a huge jump in the number of incidents and diagnoses of ADHD. So we thought it's good for us to kind of discuss the signs and symptoms and what to look for and what therapies are available and what people can do in terms of this mental health issue. Mostly in younger kids. Adults have it too. Nowadays they're testing adults as well, so there are some adults that have it. We'll go through the signs and symptoms for adults as well. But mostly it's a disorder that we see in children. Typically what happens is these children are sent to the principal, or the parents notice certain things at an early age where they're maybe not talking early enough, or maybe they're have certain behaviors which trigger a response from the parent and an inquiry wondering, hey, what's going on with my child? So we wanted to kind of discuss this and check out all the parameters and make sure that we get to resources that are needed. Every county has resources for people with ADHD, whether it's at the school level, at the school district level, or private functional facilities for ADHD and autism as well. So the term autism is utilized a lot. It's a spectrum of disorders, autism spectrum disorder, and it has many of these symptoms and signs that you'll see. Everybody doesn't have all the symptoms and signs, so there are different levels of ADHD in children, and there's different degrees, and for that to happen you have to have an assessment to get a clear diagnosis and to make sure that your kid's just not a rambunctious kid who's who's a little bit wilier and a little bit more active than others. Just because you have a child that's kind of running around, jumping around and is active doesn't mean they have ADHD. It could be that that's just their personality, and they're at a time in their life where they're exploring everything and they don't like to sit still. But there are telltale signs that you can look for that'll prompt the parent or the caretaker to go and get more professional help. A lot of teachers will also quickly jump and label children, which is not appropriate. I believe that everyone should get some type of assessment before getting diagnosed. There are people that have symptoms and signs and they don't have ADHD. So you have to get a professional to actually look at everything and do the testing and then come up with a diagnosis and a treatment and a plan moving forward. I'll discuss one other thing at Duke University, who is the only university in the US that has actually a treatment program for ADHD, and they've been successful in the last 6 to 7 years with the doctor there who's she's doing the study there, and a lot of people have seen very good results from that Duke University treatment protocol. We'll discuss that at the end of the program, but for now we wanted to kind of discuss the signs and symptoms in children, and so that you are well aware of things to look for in terms of cluster pathologies to look for. Okay, we'll start with a very simple thing where if you notice that your child or your young one is very forgetfulness, they forget a lot of things, and they're not really focused, but obvious things they forget. If you notice something like that, with and in conjunction with these other symptoms, then I would want you to go and get some type of help from the pediatrician or from the nurse at the pediatric office, so they can get you a battery of tests so that they can test your child to make sure that they don't have ADHD. Because if they do, it'll be very difficult going through school undiagnosed. You'll have learning difficulties, you'll have a lot of issues in school with them, and you'll get a lot of calls. So that's the issue. If you have a lot of calls, then it's important for you to assess what's going on with that child. So trouble getting along with others, if you get calls that, hey, your child is, it's not the odd fight or the odd call that you get, but you regularly get calls and they tell you that your child is not getting along with other children, or if you see at home that this person is not really, maybe you have 3 kids, and out of the 3 kids, this one is the one that's always problematic and always not getting along with the children, along with, they might have forgetfulness, they might have organization issues where they can't get organized. And then if you also notice something what they call risky behavior, detrimental behavior, where this person does not care and they'll just jump and they'll just do things where other children take cautiousness into mind. And if this child is not doing that and they're at an appropriate age to do so, that's something to worry about and get that assessment. Also, excessive talking where they're talking so much where it just kind of wears you out. They're talking from point to point and there's not a real break that they're taking. That's something where I would try to get an assessment if it's along with these other things. And then also, as I mentioned before, difficulties sitting still. A lot of children have that difficulty, and it comes with different age thresholds. But if your child is always not sitting still and they're fidgeting and they're moving around, they're jumping around, and they might have one of the other risky behaviors or forgetfulness or excessively talking, then I'd want to get them assessed. The other thing is a lot of daydreaming as well, So you have to kind of snap them out of it. And they're just looking through and they're looking at you, but they're not really looking at you. They're looking through you and daydreaming about something else. That's something where they might have ADHD. And again, remember, I told you there's degrees of ADHD. It's not just one size fits all for everybody. Somebody might have some aspect of the disorder and not all. So that is possible. That's why you need professional assessments for these children, so that when they're in school, they can have the best chance at accomplishing and achieving their tasks and their academic excellence at school. So this is something where it's important to keep that in mind. And then, of course, carelessness, because a lot of them won't care about getting their assignments in on time. They just have sort of like a hands-free approach. They're like, oh, whatever happens, happens. There's no big deal. And they don't tend to abide by the assignments and the terms and the time frame. They're on their own time frame. That's another thing to look for. In the U.S., between the ages of 4 to 17, you have over 7 million diagnoses a year. So that is a lot of people with ADHD. And that's something where, as the numbers have increased in the last 7 to 10 years, scientists are wondering what the origin cause of this is, whether it's environmental or genetic, and that still needs to be determined. There are some states like Arizona and Nevada who have skyrocketing incidences, and some people say, hey, the environment there has been utilized for military testing, etc. There are some correlations that they make, and then there's others that correlated to older male age in terms of when they're conceived as well. There's a study that correlates older mom and older dad. As you wait longer to have children, the percentage of having a child with ADHD increases. as does other genetic abnormalities. But these are things that people are looking at right now because we're seeing a huge number of diagnoses and incidents of ADHD in society. Um, I think the treatments, you know, there's only about 7 to 8% of the population of these diagnosed cases being treated with medication. So a lot of people are what we know as anti-medication when it comes to their children, and you know, the symptoms that they look for initially between the ages of 3 and 6, you know, that's when a lot of the symptoms appear. If the parents know what to look for, that's important. The average age of diagnosis is about 7. So, you know, 3 to 6 is when they see symptoms, and then at 7 they get a official diagnosis, and then by that time, that's when they look for treatments. You know, there's been over a 48% increase in diagnosis and incidence in the past 7 to 8 years. So those are things that are kind of important to look at. The medications that typically they give, you know, they give Ritalin, guanfacine, and these medications are good, and all they do is they calm you down. And there's nothing really effective in terms of tackling the root cause of ADHD, which is still being researched because scientists don't know the root cause. They know the after effects, but they don't know what the root causes are. So that's something important. In adults, you know, if you see an adult that's having trouble listening, avoids doing things that require effort, sort of, you know, they're very focused on instantaneous things. You know, they don't want to expend effort on long-term things. Time management issues and organization issues, you know, that's something, if they have it chronically, you know, normal students have that issue as it is, but if they have something like that, which is chronic, with time management and organizational issues, that's something to be worried about. And if it's someone that excessively, again, talks or interrupts people, and they're sort of, you see a hypervigilance in that, that's something to worry about. And then also someone that frequently loses their belongings. You know, they're misplacing things all the time. If they're misplacing things all the time, these are all telltale symptoms and signs of adult ADHD. And this too needs to be kind of focused on and treated and mentioned to the doctor. It's very important. So those are the things there. And then we have some common treatments for ADHD other than medications. Medications, you go into your doctor, they'll do an assessment, a battery of tests, and they'll offer you, you know, the mildest medication first. If that works, wonderful. If not, then they'll give you something stronger. As I said, only 7% of the people with ADHD actually are on meds. So what are these other people doing, you know? A lot of them are doing the CBT programs, which are the cognitive behavioral therapies. And, you know, this helps you with executive functioning, which is functioning of the forebrain, which are all the thought processes that you can initiate, planning, helps you with time management, helps you with organizational skills. These things need to be focused on, and they help you do long-term and short-term plans. So basically what they do is they put you in a framework, so your mind thinks in that framework, and you have those short step-by-step processes that you follow. This is what the CBT does for you, and it prevents you from having that you know, hyperactivity disorder. So this is what CBT does. There's a lot of non-stimulant medications that they'll do. There's a lot of herbs that calm the mind that people take, and also there's some antidepressants that are not approved by the FDA, but they've been shown to be effective in ADHD. They help with the attention and the impulsivity. That's something which is important. And also With the stimulants, 70% of the people report that they see an increased focus of the mind on things. So that's something that stimulant medications do. The last thing that I wanted to discuss was the Duke University program for autism and ADHD. They utilize what's known as umbilical cord stem cells. Duke University has had this program for 7 years, and they've been infusing children actually with I think a certain concentration of umbilical stem cells, and this has shown 30 to 40% cognitive improvement in these children, as well as another 40 to 50% in terms of their environmental and their social skills improvement. A lot of these children won't look at you eye to eye. They'll have breakdowns in terms of mental breakdowns and get angry. They've seen that these episodes have decreased. Their social skills have increased and gotten better. And then cognitively, they've done much better at cognitive assessments after treatment with these umbilical stem cells at Duke University. If you're interested in that, you can just Google Duke University autism study, and it'll come up. You'll see all the parameters. The study is now closed. A lot of people with children with autism have tried to get into that program, and that hasn't happened. But there are now other clinics outside Duke in other states that do these treatments in California and in other states, Chicago. There are clinics that do the exact protocol that Duke University does, and they're getting very good results in these children. It's a patient-to-patient doctor relationship. It's done off-label, but the good thing is that it's the only thing that actually addresses the root problem of autism, which is some type of inflammation in the CNS, in the central nervous system, in the nerves and the cells. So the future looks promising for this issue as the diagnoses and the incidents are increasing. There are studies and there are universities that are coming up with treatments that are actually tackling the root causes of this issue. If you do suffer, or you know someone who suffers from this issue, please don't hesitate to call us. We can give you resources where you can go and actually get treatment and get therapy and counseling, and get your people on the way to a healthier lifestyle. I thank you for attending this week. We'll see you next week. Thank you very much, and have a wonderful week.